It's important that we know how the nervous system works because it's the main way that our body communicates and regulates itself. And we need to know how this works because the understanding of nervous system allows us to understand what the animal is doing when they're anesthetized, if they are intoxicated with a neurotoxin, or if they're unable to move because of some sort of trauma to the spinal cord, trauma to the brain, trauma to the brainstem. So how does the amazing nervous system work? Well, what happens is the body senses changes. It senses it from within and without, and it sends all this information up the spinal cord and into the brain. Once it's in the brain and the spinal cord, the information is then analyzed, it's stored, and then the body comes up with some sort of response that it wants to make. A muscle response instructs the body to do something, like a muscle contraction. In order for you to lift up a book, your body has to analyze, store, and integrate that information, and then it tells your body to lift up the book. It tells your muscles to contract and work. It also works with gland secretions, so it tells your body to produce epinephrine or norepinephrine, or to produce oxytocin. So this is kind of what your body... So basically, the nervous system has three functions. It's sensory functions, integrating functions, and motor functions. And this is how it finds all the information that it needs to know how to work. So it's divided into two systems. There's the central nervous system, which is your brain and your spinal cord, and then there's the peripheral nervous system, and this takes care of your cranial and spinal nerves as well as your autonomic system, and that's broken further down into sympathetic and parasympathetic. So here is a photo of a description of what it looks like. And so you'll see your central nervous system up there is your brain and your spinal cord, and then you move down to your peripheral nervous system. With your peripheral nervous system, you have cranial nerves, and that sends information to your autonomic nervous system as well as your somatic nervous system, which is voluntary. And then your spinal nerves also send the same to your autonomic as well as your somatic. And then you have sensory nerves, and these actually send information to your cranial and spinal nerves, which then send to your brain and spinal cord. So your autonomic nervous system, this is a regulatory system that controls the involuntary action, and its communication happens through neurotransmitters, and it's also broken down into the parasympathetic as well as the sympathetic system. Here's the dog's autonomic nervous system. So somatic versus automatic. So somatic nervous system, this is voluntary. This controls your muscles. Okay? It also has something called afferent nerves, and these move the impulses towards the CNS system. And then the somatic motor function, this is afferent, and this moves the information away from the central nervous system. Then you have autonomic, which is something you really don't have to consciously think about. This is what controls the smooth muscle. This is what makes your heart beat. This is what makes your endocrine glands secrete automatically without you having to think about it. It does have sensory and motor branches to it, but it's still mostly involuntary. So here's the parasympathetic and the sympathetic system, and if you look at this graph, you'll see it's broken into two sides, and the parasympathetic, when you stimulate it, it stimulates saliva flow, it slows down your heartbeat, your bronchi constrict, you start to have peristalsis as well as secretion in your GI system. There's bile that's released to help work with your GI system, and it contracts down your bladder. Then you have sympathetic, and this is what dilates your pupils, Okay, it makes you dry, your heartbeat goes up, your lungs, the bronchi start to dilate because you need more oxygen. You don't need your GI system, so your GI system starts to slow down, your bladder starts to contract, you start to convert glycogen to glucose, and then you start to secrete adrenaline and noradrenaline. So with the sympathetic nervous system, this is that fight or flight response. This is in your thoracic and lumbar region of your spinal cord. It inhibits or opposes the parasympathetic nervous system. And so what that means is there is a neurotransmitter that's responsible for this action, and that's norepinephrine. And norepinephrine and dopamine change into epinephrine, which is a hormone. And we also see fight or flight. This is when you stop or go. And then cats, we can see the freezing response. And this is also a fight or flight response. You'll see their heart rate increases, their blood pressure goes up, their respiratory rate goes up, their pupils start to dilate. So they start to have this bronchodilation, so they need to exchange more oxygen. They're going to have some muscle blood vessels dilate, and this is so they can run if they choose to or fight. And their skin vessels are going to constrict down. Now, the main neurotransmitters that we see are acetylcholine, okay, and this works in the sympathetic and the parasympathetic system. You have catecholamines, and this is norepinephrine, which then changes into epinephrine, which is a hormone, and then there's dopamine, and actually dopamine breaks down into norepinephrine. And then you have GABA, and GABA is what your body uses to help control your fear and anxiety. And then you have glycine, and this works with your heart too. So what happens is you have acetylcholine that can be excitatory or inhibitory. And what I mean by that is when it's in the muscles, it's excitatory, but it's when it's in the heart, it's inhibitory. And basically at the junction between the somatic motor neurons and the muscles they supply, acetylcholine is excited. It's a neurotransmitter that makes those muscles contract. Where the nerve synapse at the heart, it starts to slow down the heart. Excitatory neurons basically pass on a message to the next neuron by something called the excitatory postsynaptic potential. In times of stress, these neurons stimulate in the amygdala, and they fire rapidly, and they send these excitatory signals to other parts of the brain. And this is how you get that feeling of fear or panic. So we have catecholamines, and this is like dopamine. This is what works with our autonomic function as well as muscle control. When people have Parkinson's, they have decreased number of dopamine neurons. And then norepinephrine, again, this is the arousal or the fight or flight, which then helps that stimulate the epinephrine, which is like a hormone in the fight or flight reaction. So then we have inhibitory neurotransmitters, and these are mainly GABA that we talk about. GABA is the primary inhibitory neurotransmitter in the brain. And what inhibitory neurons do is they make the next neuron less likely to fire. And this is called the inhibitory postsynaptic potential. So when the arriving of the action potential at the axon terminal of the GABA neuron releases GABA into the synaptic cleft, it interacts with the postsynaptic receptors, and these receptors open some channel ions, and they rush forward, and then they make the neuron less likely to fire. The inhibitory neurons in the amygdala modulate fear and anxiety, and they release GABA. So by releasing the GABA, it's subsequently is recognized by those postsynaptic receptors, like the GABA-A receptor, and it inhibits the excitatory signals that results in the feeling of GABA and fear. And so GABA has a calming, tranquilizing effect, and it works on helping us become overwhelmed in stressful situations. It also helps to maintain normal firing in all other kinds of systems. When we use a drug like Valium, it binds to the Valium receptor site, and it looks there's a three-dimensional shape of GABA A, and it changes to allow the GABA to bind more easily to its own binding site. And this increases the this increased GABA binding leads to increased influx of chlorine ions. And so this helps to make them feel calm. So when we talk about the GABA effect, really what we're talking about is the fact that some of these drugs potentiate the GABA effect on the brain. Okay. Glycine is also inhibitory, and it's found mostly in the spinal cord. So we're going to talk about some adrenergic or sympathomimetic drugs. And these are drugs that help stimulate the response of the sympathetic nervous system. So catecholamines that we can use that during cardiac arrest are epinephrine. We use this to help stimulate the heartbeat. We also use this during anaphylactic shock. Like reactions to vaccines or to stings or to maybe even a blood transfusion. Dopamine, we use this in shock, but we also use it in conjunctive heart failure. And we normally use this with a continuing infusion, okay, a constant rate infusion, which is what CRI means. And then we use isoproterenol, and this is a bronchodilator. And this is to help dilate the bronchi and get oxygen in. We can also use epinephrine to help control capillary bleeding. And this is called epistasis. So then we have the parasympathetic nervous system, and this is rest and restore, and it's located in the brainstem as well as the lower spinal cord, and it opposes the sympathetic nervous system. The neurotransmitter is acetylcholine, and this is the part of the brain that wants us to return to normal. So when we're in the rest and restore phase, our heart rate decreases, our respiratory rate decreases, our pupils constrict down, we need our GI system to start working, so our motility increases, our blood pressure decreases, and our bladder contracts and our sphincter relaxes. Okay, not necessarily to the point of releasing, but it helps to feel helps us to feel calm. So cholinergic or parasympathomimetic drugs. These are drugs that mimic the response of the parasympathetic nervous system. And we have bethanacol or uricoline. And we use this post-surgically for urinary obstruction to help improve the muscle tone of the bladder. We also use it to help with urinary retention. And then there's a GI drug that's called metoclopramide that is a cholinergic, and this works to control vomiting, and it helps to aid in gastric emptying. So there is something that you do need to note. When we give general anesthetic, and particularly alpha-2 agonists and opioids, and also when we are intubating, we can cause activation of the parasympathetic system. And so this can cause the animal to become bradycardic. Basically, what we're doing is we're triggering the vagal response. So the abdominal and ocular response can trigger vagal response. It lowers the heart rate. And so sometimes we have to use an anticholinergic, and we use this as a pre-anesthetic. So anticholinergics or parasympatholytic drugs, these prevent acetylcholine from producing its effects. So basically, we use these to help prevent bradycardia. We use it to dry salivary and respiratory excretions. We also may use it to dilate the pupils. It does reduce tear production because of the drying the salivary and respiratory aspect of it. It can decrease motility, so we need to be careful when we're using these drugs with horses, but it can help increase blood pressure.
So the two main anticholinergic or parasympatholytic drugs that we use are atropine sulfate and glycopyrrolate. Atropine sulfate is commonly used as a pre-anesthetic. It has a fast onset and a short duration. It has a fast onset of about 15 minutes. And then we have glycopyrrolate. Glycopyrrolate takes a little longer to take effect, but it lasts longer than atropine. It lasts about 2 to 3 hours as opposed to the 1 hour duration of atropine. Glycopyrrolate is also least likely to cause tachycardia, which atropine can do, as well as heart block. Well, if you have any questions, please let me know. I hope you enjoy.